and give us some more information about that. So, Katie, thank you so much for joining us tonight.
Absolutely, my pleasure. Do I have permission to have the floor?
Absolutely, it is yours.
All right, let me pull my slides up. Fun slides, I promise. All right. So who am I, right? So my name is Katie, and I work for Medtronic. I've worked for Medtronic close to 8 years, and all in my tenure selling this particular product that we call Link. Other names that it has been called is loop recorder, but really it's a small, almost chip-like insertable cardiac monitor. And so I've worked in this space for quite a while, and there are multiple type of cardiac monitors. Not just implantable kinds, but other kinds as well. And so tonight I want to talk to you more about heart monitoring. And so in our agenda, what I'd like to talk to you guys about is, hey there. So why monitor your heart? Okay, what are different types of arrhythmias and problems that we can have? What are different type of heart monitors? And then let's talk more about what is Link and what is an insertable cardiac monitor that I previously mentioned. So the reason why we would use a heart monitor is twofold. So we can use it to diagnose a problem. Things such as, is your heart racing? Do you feel like your heart is pounding? Do you feel a fluttering? Do you feel tired or lightheaded, dizziness? Do you have unexplained fainting spells? Or maybe have you had a stroke with unknown cause? And so those are all questions that might lead up to a reason why your physician would want to do some further monitoring and investigating. The other side of this is sometimes we know a condition of yours, such as atrial fibrillation, and we would actually want to help guide the treatment of your AFib. And so even though we know you have AFib, you may still have a heart monitor, especially a long-term one implanted. And so that way we can see, is your medicine working? Should you consider ablation or possibly another treatment? Or another avenue is, do you still have AFib after you've had a treatment? And so those are two different sides of the coin of why we would want to monitor your heart, especially when it comes to long-term monitoring. So let's talk about the different reasons why we would use this monitor in terms of diagnosis, different types of arrhythmias. So syncope is the first one we're going to talk about, and all syncope means is passing out, fainting. It's simple as that. Syncope is pretty common. Fainting, passing out, it's pretty common. In fact, it's quite a challenge. And if you look at these numbers, you can see, so 35% of the population will have at least one syncopal event in their lifetime. In fact, syncope accounts for 1 to 3% of emergency room visits, 32% of patients with syncope presenting to an emergency department at a hospital. So that's 32%. This is the part, though, that I really want to hone in on is half of patients admitted to the hospital after a syncope event leave without a diagnosis. And so that's a really huge factor into why we use heart monitors, is because of that statistic. Now let's talk about atrial fibrillation, another arrhythmia of the heart. Atrial fibrillation is also something that we take pretty serious. It can come with a lot of comorbidities. In fact, it's projected with atrial fibrillation that by 2050, nearly 16 million Americans are expected to have AFib. That's a pretty big number, especially when we break down this list of comorbidities that atrial fibrillation can lead to. And so the first is that it can lead to a 5-fold increased risk of stroke, 3 times increased risk of heart failure, 2 times increased risk of acute myocardial infarction, which just means heart attack, and a 2 times increased risk of dementia. Earlier, I mentioned strokes without a cause. And so that is essentially what cryptogenic stroke means. Cryptogenic just means unknown cause. And so really there's 2 types of strokes. One where it's called hemorrhagic, where it's bleeding, and the other is ischemic, where it is a clot. And so of ischemic strokes, those are approximately 85% of strokes are ischemic, the clotting type. And of those types of strokes, about 25 to 40% are what we call cryptogenic, where there is no known cause. Another way that you might hear cause phrased is etiology, but there is no known cause. And so we really want to investigate these cryptogenic strokes, unknown caused strokes. And the reason why is because sometimes these patients have underlying undiagnosed atrial fibrillation. And once that is diagnosed, most of the time their medicine is changed to something we call an oral anticoagulant. And if you look at the bottom right corner, there is a 67% reduction in AFib strokes with oral anticoagulation. So it's a good thing if we can get you diagnosed and put you on one. But again, it's pretty serious, right? We want to get this diagnosed and looked at because, as mentioned, there's a 5-fold increase in ischemic stroke risk for AF patients, right? We just mentioned that in the past slide. 1 in 4 stroke survivors will experience another stroke within 5 years. And ischemic strokes associated with AF, they are twice as likely to be fatal as a stroke that is not related or caused by atrial fibrillation. So now that we've broken down the different types of arrhythmias that we would be looking for with a monitor, let's now talk about the different types of monitors. So we have consumer monitors like your Apple Watch, your Fitbit. We have Holter monitors. We have event recorders. We have mobile cardiac telemetry, or sometimes those are called MCOTs. And then we have the insertable cardiac monitor. So like I mentioned, the consumers are things like your watch, right? So it monitors your heart rate and alerts prompting an ECG reading. One thing to note here though, these watches are wonderful and they're really great for keeping track. However, they do not have an FDA clearance to diagnose you, and they are not intended to replace these other means. They might be a precursor. Sometimes I've heard of them referred to as kind of like a check engine light. So we have the watch, it gives us that little check engine light. Then we go to the doctor with that information and then maybe progress to a different type of monitor, but they are not intended to replace, and they are not FDA cleared to diagnose you either. Another type that you might have heard of is a cardiomobile. And so this takes your ECG at a specific reading, a specific time. So it's important when you use these, you know, essentially to be compliant, use it when you have your symptoms, and, you know, make sure the devices are charged, etc. We also have Holter monitors. These, a lot of us are familiar with Holter monitors. They are a portable external monitor. They have the leads and wires that kind of go all over the abdomen, and you typically wear these for 1 day, possibly sometimes even 2. A different type of Holter monitor that's kind of extended is a event recorder. And so these will last for 30 days, but they typically require your activation by pressing a button when you have symptoms. There's also mobile cardiac telemetry. Those are also 30 days. However, those will auto detect arrhythmias and transmit that data on the spot in real time for you. And then lastly, we have an insertable cardiac monitor. So specifically in this case, we're talking about Link. And Link is a device that is inserted in the tissue right underneath your skin, right in your chest. And it has a battery life of 4.5 years. So we just went from 30 to 4.5 years. And you may be wondering, wow, why such a jump? And why would I possibly ever need something like a loop recorder or Link? And so one of those things is the limitations of the previous monitors I mentioned is 30 days. And so many times these symptoms are in a frequency period where they're happening once a month, once every 2 months, sometimes they're once a year. And so if they are not happening weekly, if they're only happening once a month or even more infrequent than that, sometimes it's very hard to capture these with a 30-day monitor. Keep in mind with 30-day monitors, you do take them off occasionally. You take them off to shower. Sometimes folks get irritations on their skin and they'll think, oh, I'll just take one night of sleep without one of these on. And so it doesn't always end up being 30 continuous consecutive days of monitoring like we would get in an implantable where you don't take it off for a shower or bedtime. And the other reason why you might be being implanted with a Link device is if you've already used a 30-day monitor and that came back and showed that your results were normal, and that but you're still having symptoms, that's a really good indication that you need to progress with your monitoring and keep looking. So here's some information about looking past 30 days, right? A lot of people really sometimes struggle with the idea of why would I need monitoring for a long time? And so I'm going to give you some numbers that might get your wheels turning with this information. So essentially, conventional monitoring strategies like the 30 days, they have a potential to lead to a lot of undiagnosed patients. And so 74% of syncope diagnoses, they would have been missed if we only monitored for 30 days. 74 would have been missed. In terms of those stroke patients that are unknown cause, 88% of those patients who are receiving diagnosis, they would have been missed if we stopped at 30 days. And then lastly, patients who are at a risk of stroke and AFib, 84.5% of them would have been missed had we had stopped at 30 days monitoring. So it does behoove you to keep that monitoring process moving and to keep looking. And so this is where we talk about long-term monitoring and exactly what it is. So this on the left is the Link device. On the right is Link 2. It's just an upgraded version of Link. We launched this last summer, so it's fairly new. But you can see it's very small. It's 1.2 cc's. It has an extremely long battery life. Link has 3 years. Link 2 is 4.5 years. It is MRI compatible, so you're safe to have your MRIs, you're safe to go through metal detectors, have your any type of medical testing. It has an extremely high satisfaction rate with patients at 96.7. It's pretty good. And it's portable. So with Link 2, patients have the option for bedside monitoring or app-based monitoring. And so to break it down, what it looks like in terms of how the data gets to your doctor, with Link 1, you can see exactly in this picture where we insert the device. And then you can see that the device transmits the data to a bedside monitor, and then it furthermore transmits that data to a CareLink network that your doctor has access to. So it doesn't go to Medtronic and then the doctor and all around. It goes directly to your doctor's office. They log into the CareLink network. If you have a link to, like I mentioned, you have an option. So you can use a bedside monitor to transmit from the device to the bedside to the CareLink network that your physician logs into, or you can download an app on your phone. Okay. Just some information. Sometimes people say, wow, Link, I've never heard about it. This is very interesting. How come I've never heard about it? Well, that's kind of why we do things like this, but this isn't a new device that we're just testing and trying out. You know, we are a industry leader, especially in this device. We've had the device for 23 years. We have over 700 publications and studies on this device. And as you can see on my slide, we have over 1 million patients monitored. So it's definitely a very well studied device with a lot of engineering and science behind it that has been essentially updated throughout the years, and moving on to more and more different enhancements and versions. So that's everything. And I wanted to thank you for your time and open it up if you have any questions or any comments or anything I could help clarify. And if not, then you are free to enjoy your evening. And that is the conclusion. But if you do have questions, I'm happy to take them. That's a great question. So I get this question a lot. Does it get removed after the battery life of the device? And so the answer to that is almost trifold. So once the battery has finished, kaput, the device certainly can be explanted and taken out. However, because the device does not interfere with any type of medical equipment, it does not prohibit you from having any type of testing. Some patients choose to leave the device implanted and they just leave it there. And then other times, the third thing that I see is sometimes based on what was seen during that monitoring period, those 3 or 4.5 years, sometimes the physician says, you know, because of X, Y, and Z reasons, I think we need to continue your monitoring. So we take that previous device out, and in the same sitting, we insert another one. Great question. Yes, you're fine to play an electric guitar. Fortunately, it does not interfere with anything, and usually the test is MRIs. That's one of the really hard tests for a lot of these devices to pass. So if you can pass an MRI, meaning you're safe to have one of those, then pretty much everything else on the list is safe, but certainly an electric guitar would be fine. Essentially, it does not interfere with anything. So metal detectors, MRIs, CT scans, X-rays, the list goes on. So, well, thank you for your evening. Thank you for getting on. Thank you for listening to what I have to say, educating yourselves and your community. And Nicole, if you don't have anything further, then I can, yeah.
Perfect. Katie, thank you so much.
Wonderful. All right. Well, thank you, Charles and Marcia. Thank you, Nicole, for having me.
Thank you. Have a good evening.
Thanks.